Hey guys, I'm Jade Campbell, qualified dental hygienist and therapist, and today I want to talk to you about interdental cleaning, which is using little brushes in between the teeth where your toothbrush can't get. And it's important we clean these areas because if we leave plaque bacteria there, then you're likely to get gum disease. You might notice when you start using these little brushes that your gums are sore and they bleed. Don't worry, persevere. This is just a sign of inflammation and that should start improving within 10 days to 2 week time. So there's different brands on the market. You've probably heard of Tepe's, but there's a whole different range. Some of my favourites are Interprox, that come like this, and Curaprox, which you can find like this, okay? Both of these you can buy from dental practices and you can also find them on Amazon. The other important thing to note is the size. They do come in a range of different sizes, like that, as you can see, okay? Now, the reason this is important is if it's too big, it's not going to fit. And equally, if it's too small, it's going to give the bacteria a tickle rather than remove it. And we're aiming to remove that bacteria, okay? So your hygienist can help you with this, but you can buy multiple packs with different sizes until you figure out your sizes and then make sure you've got that nice snug fit, okay? The other important thing is technique, okay? So, particularly if you've got gum disease, you want to be really thorough. So, we're aiming to clean this space here between the tooth, okay? So what you want to do is pop the brush in and cuddle the tooth, so wrap it round. You want to do about 10 times that way, and then wrap it around the other tooth and do about 10 times that way, so you're nice and thorough, okay? And then move on to the next space. Again, if it's too tight, don't force it in, use a smaller size. Also, don't forget the space behind the back tooth, okay? I know it's not a between space, but it's still really important to clean that area, okay? Like I said, if it is sore and bleeding, just persevere, it will get easier. Another handy tip is if you struggle going from one side, sometimes it's easier to get the brush and go from the inside, be it the tongue side or the palate side, like that, okay? Whatever makes it easier. Another couple of tips is, one, do it before you brush, because if you clean the bacteria out first, then when it comes to brushing your teeth, the toothpaste can flow between those spaces and work more effectively. The other thing I'd say is do it at night time, so that when you're going to bed, that all those areas are clean and you're not harbouring food or bacteria overnight. So that's all from me today. If you would like that in more detail or you've got any questions, just pop it in the comments and let me know, okay? All right guys, have a good day.